This is Frances Russell, and in this module, we will review pathology of the lower extremity venous system.
So we'll move into some pathology. So you have a 20-year-old female who presents with right leg pain and swelling. You perform an ultrasound to look at her veins, and this is what you see. So again, we're in our popliteal view. We're in the popliteal fossa. You can see artery sitting back here below vein. Artery is going to be thicker walled, it's going to be pulsatile, and you can see that better as you are compressing. And you see something sitting within the lumen of the vein. So this patient has a blood clot. It's hyperechoic, meaning it's whiter and you're able to see it just by looking at it. And then once you add compression, you can see that the walls of the vein are not completely touching and the lumen's not disappearing. So this is consistent with a popliteal DVT. So comparing normal anatomy versus abnormal. So you have your popliteal vein with compression, the lumen completely disappears. In contrast, in this patient, you can see that there's a clot sitting within the vessel and that it's not collapsing fully. This is an example of a patient with a left common femoral DVT. So if we go through our anatomy, we can see artery, which is already bifurcated here. Again, notice it's pulsatile and thicker walls. You can see common femoral vein, which is going to sit medial, and you can see greater saphenous, and these are just valves that you can see here kind of moving within the vein. This is going to be our large blood clot that we're seeing within the common femoral vein. Our next case is a 55-year-old female who's a smoker who's presenting with right leg pain. And this is an example of a popliteal artery aneurysm. So this whole structure is going to be the artery. You can see some intraluminal clot within the artery. You can see that it's thicker walled, it's pulsatile, which is telling you that it's an artery. And when you use color flow on it, you get this yin-yang appearance, which is classic for aneurysm. Other things you may see. So you may see a lymph node when you're evaluating the lower extremity. So a lymph node is going to look almost like a kidney. So the cortex is going to be darker while the center is going to be brighter. If you use color Doppler on it, it'll light up with vascular flow. And what you'll notice here is that your vessels are actually deeper to this lymph node. So here's vein, here's artery sitting below this lymph node. This is a common false positive, so it kind of looks like there's a clot within a vessel, but you notice as you're fanning the probe back and forth that it's blind ending, meaning that the lymph node disappears. And you also notice that the vessels are deeper to the lymph node. Something else you may see, which is also a false positive, is called a Baker cyst. So this is a cyst that extends off the knee joint and is filled with synovial fluid. And essentially, it's going to be dark, may have some hyperechoic areas within it. But again, if you fan the probe, it should be blind ending, meaning it disappears. Whereas if you're looking at a vessel, the vessel lumen would continue. Abscess is something else you may see in the leg. It's also a false positive. So you have this area of hypoechoic, anechoic, with hyperechoic areas within it. Could look like a blood clot, but again, abscesses are going to be blind ending. You fan away from them, they disappear. You fan back, and you can see them again.